Welcome to the education class for your total hip replacement at Burnaby Hospital. The information provided in this class is intended for people having surgery at Burnaby Hospital and does not replace the advice given to you by your healthcare provider. The class is approximately 1 hour long. We will be reviewing important information about surgery and what to expect. As well, information from physiotherapy and occupational therapy will be provided. Please keep your questions for the end of the presentation. If you do not have a surgical date, wait times for surgery are variable. Our goal is to offer you a surgical date within 6 months. This may be longer or shorter depending on multiple factors, including your medical needs. You will be offered a surgical date approximately 3 to 4 weeks in advance. Unless you have told us otherwise, you are automatically placed on the cancellation list. Cancellations do come up occasionally, so if you are ready, willing, and able to proceed, we may offer you these dates. If you are not ready to proceed with limited notice, it's okay to decline and you will remain on the wait list for the next available date. Please review all the education that has been emailed, mailed, or given to you in person before your surgery, as it is your responsibility to be prepared. You should have a copy of the exercise guidebook and are expected to start the exercises in the section titled Before Surgery. This will help you after surgery if you're able to get your body in shape. Eating healthy is important to get the nutrients necessary to heal after surgery. If you are overweight, adjusting your diet will help with weight loss, which can reduce your risk for complications and improve your overall experience. Many people struggle with weight loss when they are in pain, and we recommend following up with your family doctor and seeking a referral to a dietitian. We recommend stopping smoking 6 weeks before and after surgery, as it can increase your risk for complications, including infection. There is nicotine replacement therapy available to you from your family doctor, as well as a free resource called Quit Now. We also recommend not having any alcohol intake 2 weeks prior to surgery. If you drink regularly, please start reducing the amount that you drink so you don't go through withdrawal. This can be life-threatening in some severe cases, so if you have any issues, please speak to a healthcare provider. You will have a pre-admission appointment to come to the hospital once your surgery is booked, where you will complete final blood work, x-rays, and other tests if required. Most people borrow equipment for surgery from the Red Cross, so you will need a MEP form. If needed, this will be provided to you at your pre-admission appointment. Please pick up your equipment 1 week prior to surgery and keep it at home. We will provide you with a walker in the hospital. Please have a discharge plan in place before your surgery. Identify your support people so you can have a seamless transition home. Make arrangements for someone to drive you to and from the hospital. Many people live alone and do very well after surgery as long as they get prepared. Have at least one person you can call as needed. One of the handouts you have received is titled Preparing for Your Surgery, and you are to follow these instructions in preparation. I will highlight a few very important notes. To help prevent infection, you must do 3 washes prior to surgery with a 4% chlorhexidine soap. This can be purchased from most pharmacies. You start the wash 2 days before surgery, then a second wash the night before, and finally a third wash the morning of surgery. You must not have any solid food after midnight. In other words, have a lovely dinner and hopefully get some rest the night before surgery, as you will be coming to the hospital sometime in the morning or by early afternoon. You want to stay hydrated by having up to 3 cups of water or clear juice in the evening, and unless otherwise instructed by an anesthesiologist, you may have up to 1.5 cups of water or clear juice 4 hours prior to surgery. An anesthesiologist may also tell you to take certain medications or stop medications. In general, all vitamins, supplements, and anti-inflammatory drugs like aspirin are stopped 7 days prior to surgery. Please bring any prescription medication in the original bottles to the hospital so we can verify what you are taking at home. Doctors and nurses appreciate a fresh breath when you come to the hospital, but it is also important to have good oral hygiene to help prevent lung infections after surgery. So make sure to brush your teeth, your tongue, and the roof of your mouth, and rinse with mouthwash if you have any. If you have sleep apnea, or OSA, please bring your CPAP machine if you use one. Label it with your name, and we will provide you with sterile water. Most people stay one night in the hospital, so please plan ahead. If you are not medically fit to return home, we will keep you as long as we need to ensure your safety. Your surgery will be about an hour to an hour and a half long. You will be offered a spinal anesthetic, which means you'll get some medicine in your back that numbs you from the waist down, or a general anesthetic with sedation. The anesthesiologist will discuss with this in detail with you prior to surgery, as well as on the day of your surgery. After your surgery, you will be transferred to the recovery room for a few hours. The nurses will be monitoring your blood pressure, breathing, and temperature. They will also be checking your bandage, asking how you're feeling, and seeing if you're regaining sensation to your legs if you received a spinal anesthetic. If you have sleep apnea, you will likely stay longer, so your breathing can be monitored closely. Once you're stable, you will be transferred to the surgical ward, and you'll stay here until you're ready to be discharged. After your surgery, your goal is to get up at least once on the same day. We want to make sure you have full sensation of your legs before you stand up, and also that you are not nauseated or vomiting. The nurses will be checking your blood pressure very regularly as well. The first few times you get up, please make sure to ring the call bell and be supervised by staff. Do not do it by yourself, as we want to make sure you are safe and using a two-wheeled walker. Even when you are not walking, you want to make sure you are moving your feet and legs to reduce your risk for complications like blood clots. Walking after surgery will also reduce the risk of pneumonia and skin breakdown due to lying in bed. Surgery is not pain-free. Medication will be ordered for you by the anesthesiologist or the surgeon to help reduce your pain so you can do your exercises. Use the pain scale to report your pain, 0 being no pain, 10 being the worst pain you can imagine. When your pain level is around a 4 or 5, address the pain with medication, ice therapy, or a change in your position before it gets worse. You will be given a prescription for pain medication when you're ready to be discharged, and if needed, adjustments can be made before you go home. The other prescription you will get is a blood thinner if you are not already on one. Usually the medication is started the day after surgery to prevent blood clots, otherwise known as deep vein thrombosis or DVTs. The medication will be based on your medical history. It is usually an oral tablet, but if it is an injection, the nurses will teach you how to do the injection before you go home. You will be offered some ice chips and water after surgery. Nurses will check for bowel sounds. You want to slowly advance your diet to ensure you are able to tolerate it, as it is common for anesthesia to cause nausea and vomiting. Let the nurses know if you do not feel well. If you are tolerating clear fluids, you'll be able to have a full fluid diet, which would include soup and pudding, and by the next morning have a regular diet. This is to prevent an ileus where there is a lack of movement in the intestines, and it can lead to a blockage or obstruction. If you have any dietary restrictions, please let the staff know. Constipation is very common after surgery due to the change in diet and pain medication. Most people will not have a bowel movement for the first 1 to 2 days. You will be on a bowel protocol in the hospital and be offered laxatives as needed. We recommend that you drink lots of water to stay hydrated and to walk regularly. Increase your fiber intake with fruits, vegetables, and whole grains. Ask your pharmacist if you need laxatives at home. If it does become painful, talk to a nurse through 811 or the BC HealthLink line, or speak to your family doctor. You will have a bandage over your hip incision. Keep it clean and dry. You will likely be told not to get it wet, but you can sponge bath over the sink instead of showering. About 2 weeks after surgery, you will follow up with your surgeon or family doctor, and they will tell you if it's okay to shower. Some bandages have additional parts like a canister or battery that is used to help with healing. Nurses will teach you how to look after these bandages. You should not need to do any cleaning yourself unless instructed to. Expect swelling after surgery, especially in the first few days. It is normal as long as you can keep moving and the pain is tolerable. It will slowly subside, but you can reduce the swelling by elevating your leg and icing frequently. Ice will be your best friend after surgery. You can use ice packs, bags of frozen vegetables, or purchase an ice machine, also known as cryocuff therapy. Ice machines are nice to have but are costly. Many extended health insurance covers a portion of the cost if you are interested. We recommend icing every hour while you're awake and for no more than 20 minutes at a time to reduce swelling and pain. Make sure there is fabric between your skin and ice to prevent frostbite. There may also be a nurse practitioner involved in your care before and after surgery. They are nurses with a master's degree and they practice very similar to a family doctor. If you have any medical concerns, they can help diagnose and treat. They also collaborate with your medical team to ensure you get the best care possible and are discharged home safely. Pack light when you come to the hospital. Do not bring any valuables and label your belongings with your name so they do not get lost. You can pack your toiletries, a set of comfortable clothes to change into when you're ready to be discharged, good fitting shoes or slippers, and anything you require like glasses or hearing aids. Cell phones are also allowed, just make sure you bring your own charger. You do not need to bring your walker to the hospital as we will supply you with one while you're here. Remember to review all your education. If you lose anything or want to share with friends and family, you can direct them to our clinic website at www.fraserhealth.ca, click Find a Service, and look up hip and knee. Make sure you have made arrangements for a ride before your surgery. Pick up your equipment before surgery so it's ready for you to use at home. If there are any changes in your health while you're waiting for surgery, please let us know. Before the next presentation, we'd like to introduce you to mindful and relaxation breathing. We know having surgery can be stressful. There has been some research that show people who practice mindfulness report better outcomes as they are focusing on themselves and feeling more in control. Practicing these techniques may result in more energy, a better mood, sense of balance, and it can be a way to cope with stress and pain. So we want you to practice this before and after surgery, as deep breathing can also help prevent pneumonia. In the next 30 seconds, please follow the breathing bubble as an example of how to practice mindful breathing. Feel free to close your eyes, relax your shoulders, and get in a comfortable spot in your seat. The bubble will expand as you breathe in and shrink as you breathe out. And that's it. You can do it for as long as you like. Otherwise, you should be doing 10 deep breaths every hour while you're awake to keep your lungs happy after surgery.
My name is Dan. I'm one of the physiotherapists that may very well be seeing you after your surgery. Today we're just going to discuss a few things about how to prepare for your surgery. We're going to discuss hip precautions after a hip replacement, what you can do before you come into the hospital to prepare, what to expect while you're in the hospital, and what to expect after you're discharged home. The main message of the day, for some people a very exciting one and for some people a scary one, is usually you will only be in the hospital for one night, so be prepared. I promise you there's no catapult waiting to fire you off. This is a very goal-oriented program. We want you to be able to get in and out of bed by yourself, walk by yourself, go up and down the stairs. Once you achieve all these things, then you can go home. The way the program is organized, the vast majority of people achieve all these goals after one night. So please. So standard hip precautions. These are rules about movements that you're not allowed to make with your hip after surgery. You can familiarize yourself in your booklet with them. To know them ahead of time will be greatly useful. We want you not to bend your hip or your operated hip beyond a 90-degree angle. We ask that you don't cross your operated leg or ankle, so you're not crossing your legs, and do not turn your operated leg inward, sort of like a pigeon-toed position. You can ask your team after surgery about the specific rules or hip precautions that you have. But again, once you wake up after surgery, we're going to go over these and review these more times than you actually want to be told. But just be aware, these are the 3 most basic standard hip precautions. Weight bearing. Generally, you will be allowed to put your full weight through your surgical leg after surgery, although there will be some discomfort, and that is to be expected, but you can know that putting your weight through your leg will not damage anything that has been done during surgery. As soon as you're out of surgery, we will review this with you. If there's any changes to this, you will be made aware, but generally the vast majority of people that go through surgery are allowed to put their full weight through their leg. So before surgery, we ask that you get prepared. One very important thing is to get your equipment ahead of time. The most basic thing you will need is a 2-wheeled walker and a cane. We have circled there a 2-wheeled walker with a green circle, and we've crossed out the 4-wheel walker with a red. Many people prefer the 4-wheel walker because it moves around so easily, but for that reason, we actually prefer that you don't use it, because after surgery, it can kind of run away on you. You can get this equipment from various places. The easiest one, and the one that people usually go through the most, is the Red Cross, where you can borrow the equipment for up to 3 months and you have to return it. You will need something called a MEP form, which we will fill out for you after we measure you when you come into the hospital before your surgery. There's many other places you can get your equipment. People often will borrow it from other family members. Sometimes people do prefer to rent or buy it. We honestly do not mind where you get the equipment from, as long as you have it before the surgery itself. Day 0. So you might hear people referring to day 0. This is the day of your surgery. Once you wake up from surgery, you will notice there will be a pillow between your legs and bed. This is to make sure that you don't cross over your legs while you're asleep, and it makes sure that you keep your precautions. There are 2 exercises you can do before the physio even gets to you. One is just nice deep breathing. We usually recommend about 10 deep breaths per hour or so. This helps with any kind of stress you might be going through. It helps with pain, but really, it really makes sure that there's enough air coming into your lungs. You might not even notice it, but after surgery, your breathing tends to be a bit more shallow. The other thing you can do is ankle pumping, which really helps with blood circulation and helps sort of start to wake the muscles up after surgery. You can be prepared to get out of bed with a nurse or a physio on day 0 right after surgery and do some standing and stepping right away. Day 1, so this is the next day after surgery. We'll work a lot on pain management with ice and medications. We're going to be walking with a 2-wheeled walker. You'll go for at least 1 walk with the physiotherapist, 1 with the rehab assist, and we'll ask for you to go for 1 walk by yourself, just to make sure that you feel nice and comfortable walking before you leave the hospital. The same goes for exercises. We have exercises that we want to make sure we go through with you, both with the physiotherapist and the rehab assist, but also we ask for you to go through them on your own so you know you'll feel comfortable doing them once you go home. Stairs are usually, for some people, a bit of a scary thing to think about after surgery, but trust me in that it's not scary. It is a good idea to try stairs with the physiotherapist just so you can learn the easiest and safest way of going up and down the stairs. Once you have achieved all of these things, then you'll be ready for your discharge. Your rehab is your responsibility. So this is a bit of a corny slide, but it really is true. You only have part of your day with the physio, part with the occupational therapist, part with all these different professions, but you're with yourself 24 hours a day. Please make sure you go through and follow up with all the recommendations. Otherwise, you're sort of robbing yourself of your full recovery. So once you're home, your exercises don't stop there. We want you to keep doing your exercises at least 3 times a day. You can use your booklet. You'll see that exercises are broken up nicely in terms of weeks and how far you are into your recovery post-op. We want you to walk with your walker, and it's something that we'll discuss while you're in here specifically for you how much walking is appropriate. But usually every couple of hours we want you to get up and walk around your home. And then we want you to keep managing your pain and working on different things that we'll work on here to stay on top of your pain. And that's just keeping moving, icing your joint, and using your medications as instructed. So, outpatient physiotherapy. Once you leave the hospital, physio doesn't stop there. There's private and public physiotherapy. The big difference between the two is for public physiotherapy that's covered, there's no cost to it, it's just a continuation of this program, while private physiotherapy does cost money. It's either you have to pay out of pocket or you have to go through Blue Cross or some sort of extended health insurance. Publicly, if you live within Fraser Health, that's Burnaby or further east, we will give you a piece of paper with a phone number on it, and you just have to call it once you get home to arrange your first outpatient physiotherapy session. If you don't live within Fraser Health, if you're in Vancouver or some other area, if you're coming to us from up north, we will find the closest hospital to you and actually fax your referral form to them. There's nothing you need to do. They will just call you after you go home to set up your first appointment. But again, we do often have people ask us, I've been seeing a private physiotherapist for some time. Can I just continue to see them? Absolutely. In terms of quality of physio, there really is no difference. The big difference is just the cost. Additionally, there are community classes and resources. If you look into your booklet, I believe on page 62, you will find those there. Remember, you will likely be in the hospital for one night. Please be prepared and get your equipment ahead of time. Hip precautions are very important. Please memorize what these are, and you can go through them in your booklet. And again, you are responsible for your recovery. Please make sure and you go through and follow up with all the recommendations. And be prepared for some terrible jokes and humor to help you get through your stay here.
I'm one of the occupational therapists here, and I'll go over what you can expect from the occupational therapy perspective. And we're going to go over how you can prepare your home, what you can expect while you're here in the hospital, the daily implications of the surgery, and a few other items of equipment that we will be recommending. Let's begin by what you can do to prepare your home to make life easier for yourself during your recovery. Now, the first thing is to check the surface heights of anything that you're going to be sitting down or standing up from. This could be your bed, your chairs, your couch, toilet, car seat, and ideally you want to come to about 1 inch or 2 above the back of your knee, and that will give you the ideal height for sitting down. Now, anything that has armrests will give you the opportunity to use your upper body to help your lower body during these transfers. Next, you'll want to get rid of any tripping hazards that you might have at home. This could be a throw rug, or if you had a long telephone cable running across the floor, tidy those things up and get rid of anything else that you could potentially trip over. In addition to this, if you don't have big clear pathways to get by with the walker, you might want to consider rearranging some of your furniture temporarily so that you have enough space to get by. You'll want to consider preparing some food or getting some pre-made meals and having them available in the freezer. None of you are really going to want to be spending long periods of time on your feet in the kitchen cooking, so it's best to have these things planned out and arranged ahead of time, particularly if you don't have anybody at home that's going to be able to do the cooking for you. The physiotherapist already mentioned to please pick up and set up the equipment at home. before you come into the hospital, because it is a lot easier to do beforehand than trying to get it all arranged while you're sitting in the hospital. Next is transportation. Now, if you do drive, you will not be able to drive for likely around 6 weeks, but do have that conversation with the surgeon to see exactly what they think. Now, if you don't have somebody who's going to be able to drive you to your appointments, whether it's with the doctor or a physiotherapy appointment, there is the option of signing up for HandyDart, and we can help you with that. So anybody who's not familiar with HandyDart, it is the community bus that will pick you up from your home and drop you off exactly where you need to go for, I believe it's about $3 each way, similar to public transportation. That said, there are a few catches. They will give you a pickup window where they expect you to be waiting at the door, and it could be up to a half an hour to 45 minutes where they want you waiting for the bus to arrive. And they might also make a few other quick stops along the way, picking up some other passengers. That means that the trip often will take longer than if you had a direct ride from point A to point B. But if you don't have anybody else that can take you, then it is a good option, and just let us know. We can help you with that. And the last point here is around home supports, and I assure you that most of you will not actually need any home supports to help you with day-to-day things like getting washed up, changing your clothes, getting to the bathroom. Most of you will be quite independent with all of those tasks, even the day after surgery. That said, some people who might not have anybody at home with them might feel a little less anxious if they know that they had somebody coming in to help them out with some things around the house. And you're certainly able to look into hiring some private home supports, and there's many companies out there that can help out at home. That said, again, most of you will be quite independent with those tasks, even the day or two after surgery. All right, what you can expect while you're here in hospital. The OT and the rehab assistant will come and visit you, and we'll make sure that you're able to do day-to-day things while maintaining your hip precautions. So this would include getting on and off the toilet, in and out of bed, getting in and out of the bathtub or the shower, lower body dressing, getting on socks and pants, as well as getting in and out of the car, and we'll go over some of the showering recommendations. Equipment. Again, please do pick up the equipment before your surgery and have it set up at home. And anything that you do pick up from the Red Cross or from anywhere else for that matter, leave that stuff at home. You will not need it while you're here in the hospital. We will provide you with everything that you need while you are here in the hospital. The only thing that you might need is the two-wheeled walker, and that's only to be brought on the day you're going home by the person that is picking you up. And that will be helpful for you to get in and out of your car to get out of here. So a few of the other options to get equipment are the MEP program, or Red Cross for some of you that might be familiar with that. Other options are through extended health insurance if you have coverage through an employer. You can borrow it from friends or family. If you're a member of a club or organization like Veterans Affairs or the Masons, they often have equipment available for their members. Lastly, you could always look to purchase or rent equipment from any medical vendor. For anybody that has a walk-in shower at home, we would recommend that you use either a shower chair, pictured here, or a shower stool. They're essentially the same. The only difference is one has a backrest while the other does not. The one with the backrest will provide a little bit more support while you're sitting, but if you have a smaller shower and you're worried about having enough space, the shower stool will probably fit a little bit better and meet your needs. Anybody that has a bathtub, we would recommend this item. It's called a bathtub transfer bench. And as you can see, it is a little bit bigger and it does span over the edge of the tub, but this is nice because it is safer as it allows you to sit down on the edge of the bench and then sort of just scoot yourself across without actually having to step over the edge of the tub. It does allow you to just slide over. And next we are going to be talking about a raised toilet seat and a toilet safety frame. The toilet seat is often one area of the home that is quite low for many people. So if you're trying to maintain your hip precautions, the lower that you sit, the more likely you are to break your hip precautions. So we do want to bring that height up again to about 1 inch or 2 above the back of your knee. In conjunction with this, the toilet safety frame essentially will be giving you armrests on either side of the toilet so that you can use your upper body to help. The last items of equipment are unfortunately not available through the Red Cross, but they're fairly inexpensive and they can be purchased here at the hospital or any medical supplier, or even online suppliers would be able to provide you with these items. And they are helpful for getting on pants, underwear, socks, that kind of a thing. The first is a long-handled reacher, and you would use this by clipping the belt line of the garment onto the clip, and then that gives you the extra extension and reach to work it around your foot and bring it up to the point where you can reach the garment without bending too far forward and breaking your hip precautions. Next is a sock aid. It's a U-shaped piece of plastic with a couple pieces of string on it, and this is helpful for getting on your socks. Again, so you don't have to bend forward and break your hip precautions. And here's a picture demonstrating how it's used. And the last item is a long-handled shoehorn, which is pretty self-explanatory. It is used to get your shoes on and off, again, without breaking those hip precautions by bending too far forward. We will certainly give you an opportunity to use all of these items and practice with them here in the hospital before you go home. That is it from the occupational therapy perspective. So we will leave you with this joke and answer any questions as best that we can.
If you have any questions, we can answer them now. Or if you think of anything later, please feel free to email or call us and we will get back to you as soon as possible.